Over 60. For seeds you should never touch, and for that prevent heart attack, a simple, nutritious snack, a handful of seeds. Yet without knowing it, that very act of trying to be healthy could be silently pushing your blood pressure higher, stiffening your arteries, and increasing your risk of a sudden heart attack or stroke. This is the great nutritional paradox hiding in plain sight. I have spent years as a doctor seeing patients make this exact mistake, believing they are choosing wisely when in fact they are pouring fuel onto the fire of cardiovascular disease. Today we are going to expose for types of seeds you should never touch if you are over 60, and then, most importantly, I will share the 4 power seeds that are scientifically proven to be a fortress for your heart. Stick with me until the end, because the 4th heart-saving seed is especially powerful for women navigating postmenopausal health challenges. Section 1. The 4 seeds to avoid. Let us start with the hidden dangers, the 4 silent saboteurs of your cardiovascular system. The first seed you should avoid: salted and seasoned seeds. This might seem obvious, but the sheer volume of sodium packed into a typical bag of salted seeds is a major cardiovascular threat, especially for older adults. We are talking about salted sunflower seeds, heavily seasoned pumpkin seeds, and salted cashews. These are not just innocent snacks. They are sodium bombs. The World Health Organization recommends limiting sodium intake to around 2,000 milligrams per day, that is about 1 teaspoon of salt. A single handful of highly salted seeds can instantly wipe out 25 to 40% of that limit. Here is the science. When you consume excessive sodium, your body responds by retaining water to dilute the salt in your bloodstream. This added fluid volume is like forcing extra traffic onto the highway of your blood vessels. The increased volume makes your heart work much harder, raising your blood pressure and putting constant stress on your artery walls. This long-term strain accelerates the process of arterial stiffness, leading directly to a higher risk of heart attack and stroke. Think of Mrs. Eleanor, a patient of mine in her late 60s. She was diligent about her diet, yet her blood pressure hovered stubbornly in the elevated range. We discovered her habit of mindlessly snacking on a large bowl of salted nuts and seeds while watching television every evening. Within just 1 month of switching to unsalted versions, her systolic blood pressure dropped by 6 points, and her persistent ankle swelling disappeared. Remember, it is not the seed itself that is the enemy here. It is the chemical coating. Always opt for the raw or unsalted varieties. The second seed you should avoid: seeds in heavily processed tomato and nightshade products. Now, let us discuss tomato seeds. While whole, fresh tomatoes are rich in the powerful antioxidant lycopene and are beneficial for the heart, the seeds themselves are often tied up in the controversy surrounding the nightshade family. More practically, for cardiovascular health, the real danger is when you consume tomato seeds within heavily processed, canned, or jarred sauces, salsas, and ketchups. Why? Because these products often contain staggering amounts of 2 things that directly damage the heart: sodium and hidden sugars. The typical nightshade conversation often revolves around inflammation, but the more pressing, immediate cardiovascular risk comes from this processing. Many commercial tomato sauces are loaded with excess sodium that far exceeds the salt found in many chips, and they use high fructose corn syrup or other sugars to cut the natural acidity. Excess sugar damages the lining of your arteries, making them sticky and prone to plaque formation, while excess sodium raises your blood pressure. For our audience, many of whom have sensitive digestive systems, the high acidity of processed tomato products, sometimes including the seeds and skin, can also trigger acid reflux. While not a direct heart issue, chronic digestive inflammation is often a marker of systemic inflammation, and that does impact arterial health. Instead of worrying about the seed alone, worry about the can or the jar. When you use tomatoes, use them fresh, or if you must use conversions, choose the no salt added, no sugar added options. The third seed you should avoid: poppy seeds in excess or with certain medications. Poppy seeds are commonly found sprinkled on bagels, muffins, and breads. While they contain good nutrients like fiber and calcium, the concern here is twofold, and it is crucial for seniors. First, poppy seeds naturally contain trace amounts of morphine and codeine. When consumed in very small, typical food amounts, they are harmless. However, when consumed in very large quantities, or critically, when you are taking certain central nervous system medications for pain or mood, the interaction can be unpredictable and dangerous. Secondly, and this is a real-world anxiety for many, consuming poppy seeds can, for up to 72 hours, lead to a false positive result on a drug screening test. While many retirees might not face this, some older adults still undergo drug testing for work, insurance, or certain medical programs. The biggest, most immediate danger, however, comes from the fact that these trace compounds can subtly interfere with the efficacy of certain blood pressure or cholesterol-lowering medications, making them less effective or altering your heart rate. If you are taking any prescription medication for a cardiovascular condition, or if you are already prone to dizziness or lightheadedness, the trace compounds in an excessive amount of poppy seeds are something you should discuss with your pharmacist or doctor. The fourth seed you should avoid, mustard seeds in concentrate, especially with diuretics. Mustard seeds, often used as a spice or ground into a paste, contain compounds like isothiocyanates. The danger lies not in using mustard as a condiment, but in consuming highly concentrated forms or extracts, especially if you are over 60 and taking medication. Historically, mustard seeds have been used as a natural diuretic. A diuretic is a substance that helps your body excrete excess water and, critically, electrolytes like sodium and potassium through urine. If you are already taking prescription diuretics, a very common medication for hypertension and fluid retention, adding a strong, concentrated source of mustard seed can lead to an unexpected or exaggerated diuretic effect. This can quickly throw your body into an electrolyte imbalance. The results can be severe: sudden spikes or drops in blood pressure, dizziness, profound fatigue, and even heart rhythm disturbances or arrhythmia. Think of Mr. Leonard, who was diligently using his prescription diuretic but started adding highly concentrated mustard seed oil to his salads because he read it was a natural flush. His potassium levels dipped precariously low, leading to debilitating muscle cramps and a terrifying episode of palpitations. If you are using prescription blood pressure medication, specifically a diuretic, you must be careful not to introduce another powerful diuretic, even a natural one, without talking to your doctor first. Section 2. The 4 seeds that are your heart's fortress. Now for the good news. There are 4 magnificent seeds, nutritional heroes, that you absolutely should be adding to your daily diet. These seeds contain specific compounds scientifically proven to lower cholesterol, reduce inflammation, and improve arterial flexibility. The first seed you should use, chia seeds, the omega-3 powerhouse. Chia seeds are small, but they are a nutritional titan, particularly for heart health. They are the richest plant-based source of the essential omega-3 fatty acid, alpha-linolenic acid, or ALA. Your body cannot make this, so you must get it from your diet. Omega-3 fats are legendary for their ability to combat chronic inflammation, the underlying root cause of almost all cardiovascular disease. A major study involving over 60,000 people showed that those with the highest omega-3 intake from plant and seafood sources had a 17% reduced risk of cardiovascular mortality. For our female audience specifically, the landmark Nurses' Health Study found that women who consumed the highest amounts of ALA had a remarkable 40% lower risk of sudden cardiac death. Chia seeds help by reducing bad LDL cholesterol, improving blood circulation, and acting as a gentle, natural blood pressure regulator. Cautionary note: safety first. Because chia seeds have natural blood-thinning properties due to their omega-3 content, if you are currently taking prescription blood thinners like warfarin or Eliquis, you must check with your physician before increasing your intake dramatically. The second seed you should use, flax seeds, the postmenopausal protector. Flax seeds are another exceptional source of omega-3 ALA, but their real magic lies in their high concentration of lignans. Lignans are powerful polyphenols that act as phytoestrogens, plant compounds that can mimic the activity of estrogen in the body. Why is this critical for women over 60? Because after menopause, the sharp drop in natural estrogen leads to a corresponding rise in cardiovascular risk factors, including increased LDL bad cholesterol. Lignans can help temper this transition. Research suggests that the phytoestrogens in flax seeds can help balance cholesterol levels, supporting the flexibility of your arterial walls. Moreover, the fiber in ground flax seeds is a special kind of soluble fiber that actively binds to cholesterol in your digestive tract, helping your body eliminate it before it is absorbed. By regularly incorporating ground flax seeds into your yogurt or oatmeal, you are not just eating a healthy food. You are adding a targeted, natural defense against the cardiovascular risks that increase dramatically in the postmenopausal years. One study involving postmenopausal women showed that regular flaxseed consumption helped stabilize the balance of cholesterol, leading to better long-term heart health markers. The third seed you should use, pumpkin seeds. The magnesium miracle pumpkin seeds are a treasure trove of the mineral magnesium, and magnesium is arguably the most vital mineral for maintaining healthy blood pressure. Your heart is a muscle, and magnesium helps all the muscles in your body, especially the blood vessel walls, to relax. A magnesium deficiency is incredibly common in the American diet, and it is strongly correlated with increased blood pressure. When you consume enough magnesium, it relaxes the muscular layer of your arteries. This relaxation reduces the resistance against which your heart has to pump, like opening the floodgates on a dam, which naturally lowers your blood pressure. Furthermore, pumpkin seeds contain an amino acid called arginine, which your body uses to create nitric oxide. The molecule Dr. Miles often calls the artery relaxer, nitric oxide. Keeps your blood vessels elastic and wide open. Adding just a handful of unsalted pumpkin seeds daily is a simple, effective nutritional strategy to help you manage hypertension naturally. Patients who incorporate this simple swap often see their blood pressure numbers ease down within a matter of weeks. The fourth seed you should use, almonds, the monounsaturated fat specialist. While almonds are technically a nut, they are often grouped with seeds and are an absolute powerhouse for your heart, especially in managing cholesterol. Almonds are loaded with monounsaturated fats, the same good fats found in olive oil. These fats are highly effective at lowering your detrimental LDL cholesterol while helping to maintain your beneficial HDL cholesterol. Beyond the fats, almonds are rich in vitamin E, a powerful antioxidant that protects the delicate cell membranes of your blood vessels from oxidative stress and damage caused by free radicals. Research from the famous Predimed trial, a large-scale Mediterranean diet study, demonstrated that regular nut consumption, including almonds, reduced the risk of major cardiovascular events by nearly 30%. Furthermore, a daily almond habit can also help reduce central or abdominal adiposity, the dangerous fat stored around your middle, which is a well-known risk factor for cardiometabolic disease. I often recommend my patients replace their less healthy afternoon snack with a quarter cup of almonds. This simple substitution delivers heart-protecting fats, fiber, and protein, stabilizing blood sugar and supporting a healthy heart rhythm. We have uncovered the 4 seeds you should approach with extreme caution, especially the processed, salted, and potentially drug-interacting ones, and the 4 that offer powerful, evidence-based protection for your heart and arteries. Remember that taking charge of your heart health is not about deprivation. It is about smarter substitution. It is about choosing those heart-fortifying allies like the chia seed, the flaxseed, the pumpkin seed, and the amazing almond. I challenge you today to pick one of the 4 healthy seeds and make it a non-negotiable part of your daily routine for the next week. Will you choose the magnesium power of pumpkin seeds or the postmenopausal defense of flax seeds? Please leave a comment below to commit to your choice and let me know how it makes you feel. Your experience helps our entire Senior Forward Health community. If this information has armed you with knowledge to have a better conversation with your doctor, please hit the like button, share this video with another woman over 60 who needs to hear this, and subscribe to Senior Forward Health so you never miss another piece of vital, life-saving advice from Dr. Miles. Remember, you are in charge of your own health. We will see you next time.